Hi, this is Kathy Frey, wife, mother, parenting writer and midwife, and welcome to this podcast on delayed cord clamping. Now, over recent years, this idea has become a prevalent trend of women asking for the clamping and cutting of their baby's umbilical cord to be delayed until after it has stopped pulsing or the placenta is delivered. In our country, in New Zealand, delayed cord clamping is part of a natural physiological birthing of the placenta, and so it is supposed to be midwifery's default mode. And the immediate clamping and cutting is for a managed delivery of the placenta and should only be done for women at risk of hemorrhaging or who are actively hemorrhaging, or because the neonate needs immediate rhesus assistance and needs to go to the resuscitator for CPAP or suction. But often, in reality, we do have some old school midwives and a lot of old school obstetricians who have a tendency to go straight to that managed version of cutting and clamping the cord very quickly using an oxytocin injection, even when there is absolutely no indicating risk factors. So because of that, women have become a bit more proactive to intentionally request for the delay as part of their own birth plan. But in my experience, few mums really understand the science of what it is that they're asking for. Now, we absolutely do know that in low birth weight or preterm infants, delaying cord clamping has multiple health benefits and should be a significant priority. And delayed cord clamping also appears to potentially benefit babies whose mothers had low iron stores. So in other words, they had iron anemia in their pregnancy towards the end. However, have to say that the jury is out a little as to whether loading up a full-term healthy normal baby with extra more red blood cells after birth is truly all that beneficial. Yes, it does increase a babe's iron stores. Well, that's just because red blood cells contain iron. But full-term neonates are inherently born with a higher level of red blood cells than they actually need as they transition from that low oxygen intrauterine environment to the higher oxygen extrauterine environment. So that is why when babies are a few days old they develop jaundice, because their bodies need to break down these excessive amounts of the red blood cells. So subsequently, research shows that delaying cord clamping in a healthy, full-term newborn does slightly increase the risk of that newborn getting severe jaundice. And the other health benefits that are touted, have to tell you, scientifically, are mostly hypothetical. So my recommendation is this. With a low-risk natural birth, when there is no need to immediately clamp the cord, then it should not be done because it's not part of normal physiological birthing of the placenta. However, if for any reason the cord does need to be immediately cut, then as a parent, please don't feel your baby's missed out on some essential vital start to life. You may have actually saved him a little bit of photolight therapy to treat jaundice. So just allow it to be what it ends up to be without ever having regret. So thank you for listening to this podcast on delayed cord clamping, and for further topics which may be of interest to you and to order my books, do go to kathyfrey.com. Thanks and have a good day. Bye.